Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Guillermo Ruiz.
Hello everyone, on today's show I have a very special guest, Kristin Comella, who is a world-renowned expert on regenerative medicine with a focus on adipose-derived stem cells. I've been getting a lot of emails regarding stem cells, and I thought that it was appropriate to maybe expand on the subject and delve a little bit deeper on how to use them, when to use them, and who should be using them. Also, last week, I received a comment on my last podcast. It was so cool to know that the information I'm putting out is actually helping people. So, if you have any comments, suggestions, just leave me a note. I'll make sure to respond. And remember, visit my website, that's 3030strong.com. And if you really enjoy the show, leave me a review on iTunes. Here's the show. Thanks for being on the show. I'd like to start this interview with just you telling us a little bit about what you're doing.
Okay, fantastic. My name is Kristin Comella. I'm the Chief Science Officer of US Stemcell, and we are currently working on a variety of different regenerative medicine platforms, including stem cell therapy. Our company is currently divided into several divisions, including a division for animal health, where we can work on dogs, horses, cats, and then we have a human division where we're bringing different regenerative medicine and stem cell treatments to patients. We're treating over 30 different indications, everything from orthopedics to neurological to different degenerative diseases and even general anti-aging, and harnessing the body's own healing potential to help reverse diseases and aging.
So, what is the difference? I'm in school right now. I do a lot of prolotherapy and PRP, and a bunch of different regenerative injections. Mm-hmm. And at least in Arizona, we are just starting to do autologous stem cells. Mm-hmm. What is the main difference between the dehydrated products and the stuff that we're getting from fat or from like the iliac crest?
Okay, so the whole concept of regenerative medicine is to harness your body's own healing potential. And every single one of us has stem cells in our body working all the time. So if you, for example, went to the gym this morning and you did a bunch of squats, you would have stem cells that exist below the basal lamina of the muscle that would come out and help to repair that muscle. So what we can do with regenerative medicine is harness your stem cells from one location and put them into a location where you need them more. And so this is kind of our preference, to use your own fresh stem cells. But there are a variety of different techniques that are currently being utilized in the clinic. And when we talk about using your own cells, this is called an autologous treatment, stem cells from yourself. Versus if we were to use stem cells from somebody else, this would be called an allogeneic treatment. And currently within the US, the only way that you can do an allogeneic treatment using living cells is to be under an approved FDA trial. And there are very few approved trials right now. So the majority of treatments that are going on in clinic are these autologous treatments using your own cells. These are going to be a superior product than some of the amniotic tissue, or like you mentioned, some of the drier products. What these are an acellular product, which means that they do not have any living cells in them. They're just going to be growth factors. So when they take samples from either amniotic tissue or cord blood, they will bring those to a tissue processing facility, and they will do something called a morselization or a snap freeze, and this essentially blows the cells up because it destroys the membranes, and they get just the growth factors. So they no longer have living cells. So they're technically not a stem cell therapy.
They're not pluripotent.
Yeah, certainly not pluripotent. Pluripotent is going to be limited to your embryonic stem cells, but they're not even multipotent. And multipotent is going to be your adult type stem cells. So the difference between pluripotent and multipotent is that pluripotent has the ability to form just about any tissue in your body and really can form an entire baby. Multipotent can form a subset of tissues, so things like bone, cartilage, muscle, etc. So, for most diseases or injuries or indications that we're trying to treat on patients, we want new tissue. So, it really makes sense to utilize an adult stem cell that's multi-potential versus an embryonic stem cell, which is the more controversial cell that is pluripotential, because if you have a torn meniscus in your knee, you want to repair the meniscal tissue and maybe you want to form some new cartilage. You don't want a new baby in your knee. So
Yeah, the teratoma, you could, you have the potential to create a teratoma if you were using. Yeah.
That's right. Yeah.
Okay.
So there certainly are some more risks associated with the embryonic products. And the embryonic products are all regulated underneath the FDA. And important that patients understand the difference between embryonic and amniotic. Amniotic is also considered adult, but those products that are currently sold within the US are not living stem cells.
And a lot of practitioners are advertising these products as stem cells.
That's correct. And I think this has to do with either misinformed salespeople and or physicians, and they don't realize that what they're selling is just the growth factors. And so that is really false advertising.
Yeah, I don't think they're being evil, but
No.
there is misinformation.
Sure.
Now, you did have a couple of case studies during your presentation, and one of them was the guy who had lung disease. Could you talk a little bit about him? And maybe we can put it on my blog post, that video, or a link
Sure.
to his story.
Yeah, absolutely. So, we treat a lot of different indications, and one of the more common indications that we treat is called COPD, which is a disease of the lungs. A lot of these patients have smoked cigarettes or either been exposed to toxic chemicals. We get some patients that were previously in the military and exposed to Agent Orange, for example, and they tend to get diseases in their lungs. And what happens is the lungs become congested, they fill with fluid, they get a lot of scar tissue, and essentially start to feel like they're drowning. And there are no drugs on the planet that can reverse and make your tissue in your lungs healthy again.
The lungs lose their elasticity.
That's right. Yeah. So, and they just become sicker and sicker. They rely more and more on oxygen until they die. And it's a very vicious disease and death. Yes. So, our goal is to deliver these cells to the patients to help repair some of that damaged tissue in the lungs. And after delivering these cells, oftentimes we can get our patients off of oxygen. And they can get back to normal living, normal breathing, and functioning in a more normal way. So it's been a pretty exciting therapy. I shared at the conference, at the Bulletproof conference, a video of a man who had been given weeks to live because his lungs had become so diseased. And after receiving treatments with the cell therapy, was able to dance with his daughter at her wedding and walk her down the aisle, things that he thought he never would have been able to do, and describes it as the best time of his life.
Now, what was the method of administration of the stem cells?
When we're trying to treat the lungs, we place the cells IV. So it's just an IV push straight into the arm, and pretty easy.
And what's the volume of stem cells that you're using, and how many treatments did this particular case study have?
So typically what we want to do is collect the fat tissue, and what we do is called a mini lipoaspirate procedure. We make a very tiny incision. It's probably about the size of my pinky nail, and we then do some numbing solution just below the skin. The patient stays awake during the whole procedure, so no general anesthesia is required. After numbing below the skin, we can then collect about 60 cc's of fat, which is about the size of a stick of butter. From that, we can process to get a mixture of cells. And from that, we can get about 30 to 60 million stem cells. We usually will resuspend that in about 3 to 5 cc's of saline, which can then be delivered with just a bolus push right into the vein in the arm.
Wow. And all of this is basically an outpatient procedure.
Yeah, patients expect to be in the clinic for about 2 to 3 hours, start to finish, including all their paperwork. So it's a very, very easy and tolerable procedure. It's a walkout procedure. No limitations as far as resuming their normal activities. They should expect to be sore for about a week, but other than that, it's very tolerable.
So the stem cells, are they finding disease processes along the body, or how do you tag the cell to go to the lungs, or it's just natural process?
So this is kind of the beauty of cellular medicine. Stem cells have the ability to home to areas of inflammation. Fortunately for us, your body sends out signals when it's damaged and diseased or inflamed. And those cells hear those signals or see those signals, and they start going exactly to those areas of damage. Now, the thing is, we don't get to tell the cells where they're going to go. They decide based on what area of your body needs it the most. So sometimes a patient will come to us and say, I've got arthritis and my wrist hurts, but we did also an IV treatment, and they'll come back and say, you know what? I forgot to mention, I also have lung disease and my lungs are better. So we don't get to decide where the cells go. The cells decide.
And you did talk about a couple of aesthetic procedures that you can do with your stem cells, and you talked about sending the patients back home with some of their own factors.
Yes, yes. So, in your peripheral blood, so in the blood circulating in your body, you have many different components, one of which is your platelets. And your platelets are kind of like the first responders in your body. So, whenever you've got something that has gone wrong, your platelets will go to that area and start signaling for everyone else in your body to start helping. And they will also attach to surface receptors of existing stem cells in that area and command that stem cell to do things like make copies of itself or differentiate to form tissue. And so you can utilize these platelets in kind of a healing. I often like to think of them as fertilizer for your stem cells. And so, what we like to do is we take a sample of your blood, we spin out, we isolate the platelets as well as the serum part of the blood, meaning we get rid of the red blood cells. So, it's just going to be the yellow part of your blood. And you can take this home with you and you can use it for a variety of different things. So, if you have lung disease, you would use it in a nebulizer so you could get it into your lungs.
You can actually nebulize it like people would nebulize albuterol.
Exactly. And then you can use it for more cosmetic type applications, apply it to the skin for kind of a youthful glow and a better appearance. You can use it for sinuses, nasal spray. You can use it as eye drops if you've got dry eye. You can use it as a throat spray if your throat is bothering you. It really has endless applications. And for myself, I keep some in the fridge at all times.
That's pretty cool. So I see the banner is right behind you, and it says, "The future of medicine is now."
Yes.
So you know how to navigate regulations, and you asked us to go and push this FDA because they were trying to regulate our own stem cells. And
That's right, yeah.
And how's that going? How's the regulation aspect of this stem cell thing going?
Yeah, so this year has been kind of a big year for clinics and trying to push some of these stem cell therapies forward to get patients the treatments that they need. And the FDA has proposed some guidelines suggesting that we would not be allowed to do some of these treatments in the clinic and suggesting that they would regulate the cells that exist inside our own bodies. And so we have yeah, ridiculous.
Yeah, it's
We have
ridiculous.
kind of pushed back and said, no, the government does not own us, and the government does not own the cells that are inside our body. And if somebody chooses to use the cells that are inside their body, that becomes a relationship between the practitioner administering it and the patient themselves. And this is not something that involves the government and should not have the jurisdiction of the government. So the government held a hearing this past September, and they had speakers from all over the world come, myself included, to present their side of the story. And there was a huge showing of support for patients and for their rights and the ability to continue to do these treatments and even to extend the ability to do some further treatments within the US and to lighten some of the current regulations. So I'm very hopeful that the FDA will hear those voices that were there and make some good decisions going forward. So far, they also posted online, as I had mentioned, the ability to go and make a comment. There were over 8,000 comments received, which is fantastic. Usually, when the government puts out one of these will request statements, they get very few comments. So for them to get over 8,000 was really a big deal. And so far, the FDA has not said anything. So for us, no news is good news.
Yeah.
We can continue to treat patients, and we hope that the government does not interfere with the rights of those patients.
Now, a couple of questions about which professions are using this. I'm going to be a naturopath. I'm a naturopathic student. I'm going to graduate pretty soon. And I know Dr. Adelson out in Salt Lake, he is doing some of these procedures. What other professions and what type of training would you recommend to a medical profession that wants to get involved in this future of medicine?
So we actually have a division that's dedicated to training. This is called US Stemcell training, and physicians can attend one of our courses. They are CME, so fully accredited, and we have in-person courses that are 2 days long. We have online courses, and then we also have a preceptor program, so we can go out to the clinic of the individual practitioner to make sure they're comfortable doing all of the aspects of the procedure, including lipo and or bone marrow aspirate, followed by administration of the cells and a variety of different methods. These courses are great because it gives everything that the doctor needs to get up and running, meaning they are provided with sample informed consents, case report forms, a variety of different protocols, how to apply the cells. We go over some of the regulatory and legal aspects to make sure that physicians are up and running. The other thing that we're involved with is the Academy of Regenerative Practices. This is an organization that's dedicated to teaching physicians about some of the different aspects of regenerative medicine. And I think the key is that right now there's a little bit of a gap in med school with regards to stem cell therapy and regenerative therapies, and they're not necessarily learning some of the new techniques that are available in the clinic in med school. So this is the goal of our organization as well as the Academy of Regenerative Practices to fill that gap.
And what type of equipment are you looking at if someone wants to, let's say you have a general practitioner that really wants to, change the world and they want to go into this future of medicine. What is like the type of like minimum equipment needed for a practitioner to be doing the stem cell treatment safely?
There are three basic pieces of equipment that are required. One is a benchtop laminar flow hood. This allows for sterile processing of all of the material that will be utilized on patients. You also need a heating block, which is utilized in the adipose digestion process, allowing the enzyme to be heated up to physiological temperatures to digest the samples to isolate the cell pellets. And then finally, a centrifuge, which allows you to separate different populations based on density. And that centrifuge can be used for adipose bone marrow and for the blood products like the platelet rich plasma.
So very little investment on the part of the physician.
Yeah, I think it's not a tremendous amount of investment that's required to get up and running, and the ability to help so many patients who have otherwise been told there's nothing further that can be done for you is so rewarding. And I think so many physicians are getting into this because they are fed up with kind of the big pharma world where patients are prescribed drugs, and this doesn't necessarily change their disease outlook, and oftentimes the side effects associated with those drugs can be detrimental. And so physicians are excited to have a new tool in their toolbox and to bring new hope to patients that they would have otherwise thought nothing could be done.
And certainly there's practices that basically just do some regenerative injections or stem cell treatments.
Yeah, definitely. This is becoming more mainstream. You're seeing more and more physicians getting involved in these therapies and applying them to different indications. And many physicians have their subspecialty. For example, orthopedists are getting involved in doing joint injections. Physicians who are pulmonologists are getting involved in some of the lung treatments. So you're seeing all the different subspecialties apply it to their specific patient population.
Wow, incredible. Now, you did talk during one of the panels about how you can get around, because like as you age, your stem cells age. So if you want to bank your stem cells, or if, should we do umbilical cord banking when a kid is born, or, what are your thoughts on that?
Yeah, so our preference is to bank from the fat tissue. So we mostly are doing this for people who are adults or close to being an adult, for example, 15 and up. Um, you can get a very nice population of cells from the fat. And once you collect those cells, they can be culture expanded and then stored. And from that one pull of fat, we can get about 20 to 25 additional doses of pure mesenchymal type stem cells. And the beauty of banking it right now is that you are never as young as you are today, and your cells are never as young as they are today. Unfortunately, our telomeres begin to shrink, and this happens as we age. So locking in that telomere length when you're younger may prove to be beneficial. Now, that being said, I've had patients who are in their 90s that I've gotten some fantastic samples of stem cells off of. So it's not that we can't get stem cells off of you when you're older. And really, nobody understands what the difference is between the cells that we can get from a 90-year-old versus those from a 20-year-old. It may just be the number of cells that we can get is less, and not necessarily that the quality of those cells has gone down. We just don't know yet. There's still some more data that needs to be collected there. With regards to some of the cord blood and banking your cord blood for future use, this is not something that I chose to do for my children. What I did instead was allow the cord to continue to pulse until all of that blood went immediately into that baby at the time of birth. The reason being that I wanted them to get all of their stem cells right at that time. And then I figured if I got in a situation where I needed stem cells for my child, I would do one of two things. I would either take samples of fat from them, or if for some reason we were not able to take a sample of fat, then I would go for an allogeneic dose, either from myself or from someone who I felt comfortable using, and that would have to be applied outside the country. So the downside of the cord blood banking is that they do not expand the stem cells from the cord blood at all. So it's more the
for our people that might not be medical professions. What do you mean by expanding the samples?
Yeah, so they would isolate and take out the stem cells and then grow them in a culture dish. So multiply them. When they take your cord blood, they don't multiply them at all. All they do is store that whole cord blood. So you're a little bit limited with how you can use that cord blood. It's not a pure population of stem cells, and it may or may not be useful. And you're also limited with how you can use it within the US due to the existing regulations. So oftentimes, even though it's legal to bank your cord blood, it becomes illegal to use that cord blood.
That is insane. Why would they allow for this first, part of the, of storing the blood if you cannot use it? Now, worldwide, who is at the forefront of this stem cell treatments?
I think we're probably one of the oldest companies. We were founded in 1999. We've done more clinical cases than any group out there, more than 6,000 cases. We work with facilities throughout the world to bring these therapies forward. I'm not sure that there's anyone that has done quite the same level that we have done, just because we've been around so much longer and really pioneered some of these different treatments. There are certainly a lot of individual practitioners who are doing some fantastic work and applying these therapies in unique ways.
Wow, and that's it. How can someone get a hold of your clinic? Where are you located? I'm actually in Florida right now for this conference, so it's kind of funny.
Yeah, fantastic. Yeah, we're in Sunrise, Florida, which is close to Fort Lauderdale. Miami area. Our website is usstemcellclinic.com, and patients can contact us through the web. There's a phone number there. We also have a Facebook and LinkedIn page and a YouTube page, so there's quite a bit of information available on the net.
And finally, what should we be doing as students, as practitioners, in order to prevent the FDA from disallowing us from doing all these magnificent things?
Yeah, I think just remember that you have a voice. And, one of the things that we felt is important is to speak to our local Congress people to make sure that they understand that the FDA is considering changing some of these laws, and that make sure that your local representatives represent you as a person and that they're voting appropriately when they choose to change or not change some of the existing laws, and just be aware of some of those things that are going on. So, one of the things that people can do is join our mailing list, because we're always providing updates on the regulatory environment and whether or not there's going to be any changing with regards to the FDA stance.
Well, that's great. Yeah, that mailing list. I'm part of the mailing list, so I'm always I have an alert to make sure that if there's anything that I can do as a student, or I'm able to vote with my voice.
Yeah. Now, the other thing I recommend for the students is we do a journal club every couple months, and these are free webinars that students and/or physicians can join into just to learn about what the latest and greatest with regards to regenerative medicine is.
And now, and this is like across different professions. You mentioned you work with animals.
Yes, we do. So
Any cool studies or any cool case studies that you might want to tell us about?
yeah, we actually just did a very cool case. It was our first ever dog who had been attacked by an alligator here in Florida. And, the dog had a pretty bad laceration. And one of the biggest issues after getting attacked by an alligator is the risk of infection, which can be quite deadly. And the alligator mouth is actually very dirty for the dogs. So what we did was several serial injections of IV stem cells for the dog to help fight off any infection that would be going on and to help stimulate an immune response. I'm happy to report that the dog has made full recovery and has done quite well despite being bitten and almost eaten by an alligator.
That's amazing, and to be able to apply this, to humans, because there are cases of alligators biting kids, and
Yes.
it's kind of crazy that sometimes we have to go through this other means in order to create the studies. One of my friends, his dog had a hip replacement, and that hip replacement cost him $2,500. And they're using the same materials and techniques that you would use for a human, and that's around $100,000 for a human to go through this procedure.
Yes.
And
Yeah, there is price gap.
Yeah, there's a price gap. And the reason of this price gap, I believe, is because of this hidden economy of the insurance companies and the regulation that are behind them.
Sure. Yeah, and the benefit of regenerative medicine and stem cell therapy is we can help you avoid those joint replacements. And many of our patients have come to us after their surgeons have told them they absolutely need a joint replacement, and we have successfully kept them away from those replacement for 5+ years and going.
And I imagine that it's going to cost less than $100,000.
Oh, absolutely. Yeah. So typical treatments are anywhere in the neighborhood of 3,500 to 12,000, well under any sort of joint replacement.
Wow, that's amazing. Now, finally, what's the future? What do you see? What's the next step? Where are you taking this? What's going to be the next chapter in stem cell therapies?
Yeah. So I think when we began, our focus was to treat sick patients and to help patients who, especially those who had been given no other choice and turn to us. I think the next phase is to treat patients who are healthy and use this as kind of an anti-aging. In the future, I see that everyone will get their regular stem cell injection every 6 to 12 months. And this is actually something that I already do for myself. At any given moment, you've got inflammation in your body, and one of the most aging things that occurs to us is inflammation. So to be able to keep that inflammation down is going to help extend our lifespan. And so we'll be looking at lifespans at 100 plus in no time once we start integrating these regular stem cell treatments for patients.
And you couple that with good, a good anti-inflammatory diet, a good practitioner that doesn't think you're crazy because you want to inject your own stem cells, and then a company like yours that is advancing this movement. And yeah, I believe that the first person to live to 150 has already been born.
Yes.
Yeah.
It might be me.
Well, but you have an unfair advantage. So, well, Kristin, thank you so much for this interview. This is super fascinating, and I hope a lot of people listen to this and start signing up for email newsletter, and we can get other practitioners and students in the future of medicine listening to this interview to really advance this and support you.
Yes, thank you. Appreciate it. And good luck to you and everyone who's watching this recording. Hope to see you either in our clinic or at one of our conferences.
Well, thank you so much.
Okay, thank you.